Next, we're going to have Ashley Thompson and Sarah Best, are two of our amazing MS nurses, join us to present on untapped resources to help with your MS symptoms.
Hello, my name is Sarah and this is Ashley, and we're going to be talking about untapped resources in multiple sclerosis and options available that might be able to help with some of these symptoms. So MS patients will often experience a number of different symptoms. On the slide here is a list of everything. Some patients may have some of these symptoms, other patients may have just few symptoms. It's all very individualized based on their disease. So looking at the symptoms first, one of the most common symptoms that MS patients will experience is fatigue. This is noted to occur in about 50% of MS patients. It's very common and can impact one's life in very different ways, from one's job to employment to hobbies and life outside of work. So now we're going to look at non-pharmacologic ways to try and help with fatigue, or basically that means ways to help fatigue without using a medication or a pill. Some of the first things that we would look first is to address any sort of sleep issues. So poor sleep, or if somebody has an underlying issue such as sleep apnea, we would look at trying to fix that to help with one's fatigue. And that would help us then determine, is the fatigue as a result of the MS or of something else? We would also look at ways to improve one's energy, which would include mindfulness and cognitive behavioral therapy, or CBT.
And then another thing for fatigue is we talk about a lot of sleep hygiene for our patients, ways to make sure you're getting the most out of your sleep. So try to maintain a regular sleep schedule, go to bed, wake up at the same time every day, minimize daytime naps to less than 1 hour, so a true power nap, not a snooze fest. Try to avoid drinking fluids late in the day. If one of your problems is having to go to the bathroom a lot at night, make a cutoff time for yourself where you'll stop having fluids. Avoid caffeine and alcohol before bed. They irritate the bladder wall, which can increase urinary frequency or having to go to the bathroom. The bed should only be used for sex and sleep. So you're not supposed to play on your phone all night. You're not supposed to binge Netflix all night. It's solely there for you to rest. If you can't fall asleep, get out of bed. Try to engage in a quiet activity for a little while. See if you can get your mind off the stress of trying to fall asleep. Distract yourself so maybe you can get to sleep. And then at our center, we do talk a lot about cognitive behavioral therapy. We have stress, anxiety, depression. With cognitive behavioral therapy, it can help see the way that you think about things and try to change the way that you do think about things. So if you're in a current situation, you're thinking, how can we redirect those thoughts in a positive way so your mind can turn off sometimes? And then in mindfulness, Diane, one of the NPs, has this poster at her bed. Is your mind full, or are you being mindful? Are you present in this situation? Are you there listening and conversing, or are you thinking, I have to do 4 loads of laundry, I have to sweep the floors, I have to get the lunches packed? But trying to be there present in the situation, so you're more focused on what's happening when, and conversing with whoever you're hanging with. And then for physical ways to manage your fatigue, aerobic exercise or yoga. Exercise releases endorphins, can make you happier, improve energy levels. Physical therapy can help develop a program for energy savings. So if you are having a problem where you're always dragging your heel, maybe you need a physical therapy regimen to talk about ways to work around that. Improve your gait so every step that you take is useful and you're not wasting energy on those steps. Swimming, cycling, if you're chair bound, there's a lot of things that you can do with just upper body stuff, hand cycling, but your physical therapist could definitely help develop a regimen. OT works a lot on helping with energy conservation. We have a program where they can go into your home and make modifications so the layout of your home is best benefiting you. And then during the day, when do you have the most energy to use? So don't wait until 6 o'clock at night when you are a limp noodle and can't go anymore. Try to make sure that you're doing the important things when you have energy and then saving other things that maybe don't require as much energy at the end of the day.
And then our next symptom to talk about is mood changes. So depression and anxiety are very prevalent in the MS population. This can affect up to 50% of patients or more. And like fatigue, it can impact every aspect of one's life. From work to personal life to family life. But what can we do to help with depression and anxiety? So non-pharmacologic or non-medication ways, again, we mentioned exercise to help boost energy levels and help improve mood. Again, we mentioned cognitive behavioral therapy or CBT, counseling, or even a behavioral health referral to help engage in stress management. Socialization and support groups are available and recommended. Being around, especially for the support groups, people that understand the situation, understand MS, it can be very helpful. And then the National MS Society has a brochure called Taming Stress in MS, which can be located on their website, which also has helpful suggestions on ways to try and help with one's stress.
And then, have you guys seen the Lego movie? Exercise is awesome! Exercise to engage in physical activity or sustain or improve your health and fitness. Exercise is actually shown to be one of the most beneficial ways for MS patients to manage symptoms. All of the symptoms that we talk about, if you are in a regular exercise program, is just so good. It can cut down on your medication use as well. Fatigue, depression, anxiety, spasticity, weakness, and pain. So get moving. Come over and visit Lauren. Benefits of exercise. Actually, I read a study that showed it can slow your annual relapse rate and disability progression. With the disability, if you're staying and maintaining, so it's not necessarily that you're exercising to get stronger or faster, but you're exercising to maintain your current level of where you're at in your MS and help mitigate having additional symptoms or additional disability develop. There are studies that show that exercise is safe for MS patients, even with balance issues, weakness, and things like that. There's no increased risk to exercising compared to the average population. And there's new technology coming out if you're severely debilitated or immobile, functional electrical stimulation. The center here has the stuff in the ceiling to help if you could help with balance and things like that if you're very unsteady, and just help to improve your muscle coordination and gait as best we can.
And then the next symptom we're going to discuss is pain. So many MS patients will experience pain over their course of the disease, and it may come in many different forms, such as neuropathic pain, which might manifest as painful numbness and tingling. It could be a burning sensation or electric sensations. Lermite's phenomenon, which is when one bends their head forward as if they're tucking their chin to their chest and might feel an electric shock go down the spine. Trigeminal neuralgia, which is irritation of a nerve in the face that causes very severe pain. The MS hug is what some patients will feel like a banding wrapped around oftentimes their torso or chest, but could be other areas. And then optic neuritis could present with pain, especially with movement of the eyes. And lastly, spasticity, which is when the muscles are working against each other, trying to contract, causing stiffness and muscle spasms. So there are different ways to manage the pain. The first one, again, is CBT, and that would help you in a way to try and refocus the way that you are looking at the situation and the way that you are thinking of the pain. Acupuncture is another option, which that would help release endorphin, serotonin, to help decrease the pain response. Physical therapy is a great option, especially if the pain could be caused from some sort of gait dysfunction. So if you're walking funny due to MS or weakness, a physical therapist can look and see what can be done to try and correct the areas that are lacking. That way the gait can be more normalized and therefore not stressing other muscles as much. Stretching is something we recommend that can help, especially with spasticity. Gentle stretching, 1 to even more times a day if possible. And then exercise, either traditional exercise or aquatic classes, can be very beneficial. For patients who have a hard time walking and whatnot, aquatic exercises can be very helpful because you've got the water there to provide a support, which can, help relieve pain as well. And then we also recommend looking at the National MS Society. They have a lot of great resources on ways to address pain.
And then with mobility changes, a lot of our patients either have spasticity, weakness, and it's causing gait dysfunction. So finding out what the cause of the mobility change is really helpful. We can have you come into the clinic to have a really good head-to-toe neuro exam and see if we can determine the cause of a change. Are you having a relapse? Are you having progression? And we just need to get a couple more tools in your toolbox to make sure that you can ambulate safely. At the Riverside location, we can have neuro PT and OT come and see you, and we can have speech therapy come for swallow evals. But that's only at Riverside, so the off-sites don't get that benefit as much. And then other ways to help improve mobility: exercise. Building up as much strength as you can get, or working on making sure you maintain, is really important as the disease progresses. We have you see PT and OT. Maybe you need an assistive device. Would you benefit from a rollator or a cane or something, maybe a cane to help your balance a little bit, or a rollator to help your balance, and then maybe that seat for some energy conservation. And then there's other things like the AFOs that we could do, and just making sure that we manage energy appropriately, which PT and OT could also talk to you about. For physical therapy, they'll focus on your ambulation, strength, balance, posture, fatigue, and pain, among other things. They'll help develop a safe exercise program and help you to adapt to any mobility aids or like assistive devices that you might need. And we also have a wheelchair clinic at Ohio Health that we could refer you to, and they evaluate your need for a chair, and then they measure you and get you all the bells and whistles that would be the best for you. And then occupational therapy, they help you find the tools and techniques to simplify your tasks and promote independence. So for activity modifications, they want to help evaluate your activities of daily living. What are you doing that maybe is causing you too much energy, and what can we do to help make sure that you can stay independent in your bathing, grooming, feeding yourself? Exercise training, start a program that addresses upper extremity weakness or incoordination. Cognitive training, they'll help assess your problem-solving, attention, memory deficits that can affect your ability to perform your activities of daily living. And then a functional mobility evaluation is they'll see how you are moving around your home safely and effectively. And then that could be the part where the home modification program could come into play as well.
Looking into cognitive changes a little more in detail. So this could be anything regarding one's ability to think, to reason, one's concentration, or memory. A lot of patients will refer to this as cognitive fog or cog fog, where their thoughts just feel kind of hazy. A lot of patients will have questions when they're having cognitive issues, like walking into a room and wondering, why did I come in here? Or they can't think of a word that they want when they're in a conversation. Perhaps they're turning in work late, missing deadlines. Things like that could tell us that there might be a cognitive problem. Non-pharmacologic interventions for this would include speech or occupational therapy. They can help with techniques to help with one's memory and suggestions to help with that. Exercise, again, can help memory as well. So we recommend that since it seems to help with a lot of different various things. On their own, patients can try brain-related activities such as crossword puzzles, Sudoku, mind games, and that sort of thing. And then we can talk to patients about ways that they can help mitigate their cognitive deficits, such as making lists, setting alarms to remember things, putting reminders in the calendar for events that they need to know about and appointments. And then we also want to treat the underlying mood disorders. So if one has depression or anxiety or anything else going on, we would recommend that be treated, which can then in turn help with one's memory. And then getting good sleep, which goes back to sleep and how we want to treat any underlying issues. Once one's sleeping's better, their memory tends to be better as well.
Heat sensitivity. A lot of our patients are heat sensitive, and it's known as Hoff's phenomenon. And basically those nerves and pathways are already damaged, and when you get hot, the connection slows down even more. So you could have an increase in your symptoms. You're weaker, you're having more numbness and tingling, but then you sit down and you're like, what's going on? And you cool off, and then all of a sudden everything's gone. That the pathway is reconnected once you cool off. It can happen for some people with cold, but usually it's when you get overheated. Somebody called like every day for 2 weeks, and she was like, every time I get out of the shower, my toe is pointing left, but then it goes away. And I was like, well, how hot are you showering? And she's like, all the way to hot. And I was like, well, and that's why. So that she learned that connection, that when she gets hot, that it was going to make that symptom worse or come back for a little bit and then go away, because it did improve. We usually recommend cooling vest towels that you can get to make sure that you stay cool, or if you're going to be somewhere where you know you might get hot, you can cool yourself down fast. Some of our patients, when they get so hot, they just can't move. So they would need to get cooled down fast so they would be able to get back in the car from where they are, or get from the bed to their chair. The National MS Society does have a list of discount codes to help with the products, and there are 2 applications that you can fill out. They're based on your income, on whether they can help you purchase the cooling products. And we do have a cooling vest at the clinic that shows you what it's like. They're kind of bulky, they can be heavy, but it's a really good way to make sure you stay cool. But you can even bring a cooler and freeze some towels in there and just put it around your neck. Like if you're going to go to the beach or something. But really the only way to make sure you don't overheat is to avoid the heater getting hot. So it kind of hinders exercise a little bit too. So maybe for the exercise part, you could think more about water therapy or water aerobics. That way you would stay cool in the pool, but still be able to get the benefit of exercising.
So the next symptom a lot of people experience can be vertigo or dizziness. And there's a number of causes unrelated to MS that could also cause this. So we'll ask questions like, do you feel dizzy? Does the room feel like it's spinning? And have someone describe what they're feeling. In a clinic evaluation, we can have our neurophysical therapist do an evaluation to try and help determine, do we need a referral to vestibular physical therapy? Additionally, we would recommend investigating other causes for the dizziness, because if it's unrelated to the MS, treating the underlying cause will then help with that. And then again, possibly need a referral for vestibular physical therapy if we feel like that's related. Going into a little more detail, these physical therapists will have a patient engage in various head movements, that will try and move calcium crystals in their inner ear to relieve some of the symptoms that they're having related to this vertigo. This can help if it's related to an issue within the inner ear. However, if the dizziness or vertigo is related to an MS lesion, then this may not be super helpful. But if it's due to an active lesion, that's something then we would want to see if, steroids might be an option.
Speech and swallowing changes. You can have a lot of things that can cause issues with your speech or swallow, weakness, muscle spasticity, any numbness. We can have you at Riverside. The speech therapist could come down and do a quick swallow check. They use different consistencies of liquids and food, and they see how well you swallow or if you're able to chew the food. Maybe you're having motor fatigue related to having to chew a dry cracker. So they could come down and see that and see if you would benefit from speech therapy ongoing to get strategies on how to improve your swallow, or any strategies that you might need for a swallow. Some people have to tuck their chin to their chest or use different consistencies for liquids for swallowing. And then the swallow that they do in the clinic is basic. We can also send you to a fluoroscopy swallow, and they put barium into the liquids and onto the food, and they can see how you chew it and how it goes down, and if it goes down all the way, or if you have residual that hangs here, because maybe you're not swallowing it all the way because you're not coughing or showing that you're having a trouble swallowing, but you keep getting maybe pneumonia, or you keep feeling like you're coughing something up later. Are you getting it down all the way? And that x-ray helps to show a little bit more of the mechanics of your swallow.
And then the next symptoms are related to the bowel and bladder. It's not uncommon for MS patients to have issues with urinary urgency, frequency, where they're having to go to the bathroom more times during the day than normal, hesitancy, where it's hard to start the urine stream, or urinary retention, where when they empty their bladder, they're not able to empty it all the way. And then lastly is incontinence, when someone has an accident with going to the bathroom that wasn't planned. Bowel problems can include constipation and incontinence. And these are big issues because they can be very upsetting to a person, very embarrassing if someone's out and having an accident. As far as bladder issues, what are we able to do? Well, the first thing that we will look for a urinary tract infection, as those symptoms can be the same. So the frequency, retention, but they can also have other symptoms such as cloudy urine, burning with urination, odor to the urine. And if it's an infection, then we would want to treat that. And then once it's treated and someone's over the infection, their symptoms should ideally improve. If it's not related to a UTI, there's certain things we can do, such as scheduled toileting. Basically, that is where you create a schedule and you go to the bathroom on that schedule, such as if you're going out, be sure to use the bathroom beforehand, so hopefully you won't need it until some period later. It's important to ensure that one's fluid intake is appropriate. If one's dehydrated, that can cause issues. So drinking water during the day, but then maybe perhaps stopping their fluid intake closer to the evening before bed so they're not getting up repeatedly. And then we can also do a urology referral where we refer to a urologist to see what additional treatments or therapies might be available. If one is having sudden new incontinence, then we might be worried about an MS flare. So that would warrant new MRI imaging to see if there's a new lesion.
For constipation, make sure you're getting enough fluid and fibers. Dehydration definitely dehydrates the bowel as well because the bowel wall sucks water in to make everything go okay. And if you're already dehydrated, then you can't get enough water into your stool and you're going to be constipated. Scheduled toileting or a bowel regimen. Maybe in the morning, first thing, have your prune juice and then go to the potty and see if you're able to go. Be physical. Constipation definitely can be worsened in the setting of immobility. And if you're already immobile, then we need to make sure that you're doing the bowel program and have good fiber and fluid intake, because that physical activity will be playing against you. If you're having bowel incontinence, we need to know right away. If it's new and sudden, we definitely may need to get MRI imaging. If it's something that continues to happen and the MRI is stable, then we'll talk about bowel programs and things like that, so we can make sure that you're not having accidents. And also pelvic floor therapy can be helpful with this as well. Maybe you have weak bowel walls.
So pelvic floor physical therapy, that looks at the pelvic floor, which is the group of muscles that control the bowel and bladder. When there's an issue, that's when the muscles aren't working together or are weak, or perhaps they're spastic and unable to relax. We have a physical therapist who focuses on pelvic floor, who we can refer to and help make a specific plan for each individual to assess their needs. And then in summary, the most important thing is with all these symptoms, especially if they're new or something's changed, is communication with the care team. We won't know anything's wrong if we're not told about it. So communicating with us will help so we can make a plan and figure out what's going on and ways to fix it. If one's ever unsure if their symptoms are from MS or not, speak with us. We're more than glad to help try and figure out, could it be from an infection? Could this be from stress? Could it be from any number of things? And then if it is from MS, we would want to see you in clinic. And then again, exercise, we just want to stress how important that is. Exercise just impacts so many different things. And it's something that someone can do where it doesn't have to cost money, it doesn't have to have a medication, and yet there's numerous benefits.
Exercise is awesome!
That was excellent. Thank you so much for a fabulous overview. And I think that is just the best preceding talk about the benefits of exercise.